Hello, my name is Catherine Sekbefia from the Department of Child Health, University of Ghana Medical School and Kolebu Teaching Hospital, Accra, Ghana, and I'll be presenting on point-of-care diagnostic for fetal hemoglobin quantification in children undergoing hydroxyurea therapy for sickle cell disease in Ghana. We know that sickle cell disease can cause many complications and can result in early death. And the majority of people who have sickle cell disease live in sub-Saharan Africa. In Ghana, for example, 1 in 50 newborns has sickle cell disease. Now, fetal hemoglobin, or HbF, is a strong modifier of sickle cell disease severity. When HbF levels are high, there is inhibition of sickling and a reduction in disease morbidity and mortality. And HbF monitoring is useful to assess adherence and response to medications like hydroxyurea. The problem, though, is that standard electrophoretic techniques are unable to quantify HbF. And in resource-limited settings like Ghana, the use of high-performance liquid chromatography for HbF quantification is challenging due to its high cost, limited availability, and limited numbers of laboratory staff who are appropriately trained to do HPLC. So in this study, we assessed the performance of a low-cost point-of-care microchip-based cellulose acetate electrophoresis gazelle compared to HPLC for HbF quantification in children with sickle cell disease. Gazelle is a fast and easy-to-use test which can be performed with a very small volume of blood by people who have been minimally trained. Now this slide shows how the gazelle test is done. So a small volume of blood is mixed with the marker fluid, and then 50 microliter of the buffer is added to a cartridge, and you wait for a minute, and then you place the blood sample on a slide and dip the stamper into the sample. Then you use the stamper to apply the sample to the cartridge that contains the buffer. The cartridge is inserted into the reader of the Gazelle machine, and the results are available in 8 minutes. So Gazelle has many advantages. It is affordable, particularly for low and middle income countries. The turnaround time is very fast. It is able to withstand extreme heat and humidity, and it can be battery operated, which is useful in places where electricity supply is unreliable. It's easy to operate, and it is 99% accurate compared to lab-based HPLC, and it's able to identify 19 HB variants. So this slide shows an example of Gazelle detecting HbAs, or sickle cell trait, and this shows the separation of the hemoglobin types and availability of full results within 8 minutes, which include the HB types, the percentages, and the interpretation on screen. So this was a cross-sectional study which was conducted at the Pediatric Sickle Cell Clinic in Kolebu Hospital. Kolebu is the largest hospital in Ghana, and the Department of Child Health sees about 36,000 children per year. Our study participants were between the ages of 1 and 16 years, known to have sickle cell disease and followed at the clinic, and were either about to commence or were on hydroxyurea therapy. And of the over 500 samples collected, Gazelle showed a correlation of 0.98 when compared to HPLC, as you can see from the graph. And so in conclusion, hemoglobin variants can be quantified by Gazelle, offering the ability and opportunity to monitor disease-modifying therapy in sickle cell disease like hydroxyurea, where HbF level quantification is important to assess treatment adherence and also determine the response to treatment. and particularly in limited resource settings like in Ghana and across sub-Saharan Africa, Gazelle has the potential to be used as a point-of-care test for quantifying HbF levels in children with sickle cell disease who are on hydroxyurea therapy. Thank you.